And now for our keynote speech today, we are honored to have with us Ms. Saba Mubaslat, the Chief Executive Officer of the Humanitarian Leadership Academy. Would you please join us at the podium?
Thank you for having me. And usually when you're asked to give the keynote speech, you try to write all the right things and say all the right things. But after listening to this morning's panelists, I think I'll just throw away my speech and speak from the heart. I've been working as a humanitarian responder for 25 years. And I've been, I started as a very junior, no one in the field, responded to 16 different conflict situations from Gaza to South Lebanon, to Libya, to Syria, name it, all the interesting places in the region. And I find myself now working as a CEO. Becoming a senior person, you tend to attend lots of conferences. This year, what? Am I in trouble? Okay.
It's doing it yourself.
So this year, this might be my, 15th, 16th participation. And we come together, very important people. We take time from our very busy schedules to talk about the exact same things. We talk about poverty, we talk about conflict, we talk about illiteracy, and we talk about man-made disasters. And then what? We had the exact same discussions this year in Davos. And then we went to Dubai, and Shadi, you were there with me, and we repeated ourselves. And I went to Riyadh, where there was a first-time humanitarian response summit, and we repeated ourselves. What really saddens me as a practitioner, as someone who worked with the refugees and with the most affected, is that they're usually not in the room. We discuss them in their absence. We decide what works best for them. And then we projectize our interventions and talk about all the, fluffy things and the very fashionable ideas, from innovation to use of technology to what have you. They don't know much about what we think is best for them because they're never around the table. So maybe we need to be a little bit more realistic with ourselves and respect the fact that those affected people are extremely effective. In fact, if they weren't, then the likes of Gaza and Gazans won't be around anymore. So let's keep in mind that the ones in the center of action are not in the room, and they deserve to be well represented. There has been lots of light shed on problems and challenges this morning. I want to maybe just reflect on a couple of thoughts that may present a beginning of a solution for us to discuss further in the coming 2 days while we're here hosted by this great institute. And these are really collaboration, which is a very old new word, and innovation, another old new word. When it comes to collaboration, it's becoming quite evident that none of us can do this on our own. You talk about health as someone who worked in humanitarian responses. If you go to the typical cluster meetings, health says, unless health needs are met, nothing else would happen. Education say the same, child protection say the same. I think it's about time for us to realize that people do not live in projects and do not live in silos. The well-being of an individual cannot be achieved unless that individual is addressed and worked with and planned for in the most holistic, human-centric way. So health is one aspect, a critical aspect, but there are other things that need to be taken into consideration. This morning we heard from one of the prestigious, very well spoken and articulate panelists about the fact that it is the government responsibility to address public health. Unfortunately, in most of the contexts that we work in, governments do not exist, or governments are not in control. So I think it is about time that we talk about collaboration in a practical way, talk about the role of private sector, talk about the role of reducing the cost of healthcare and access to health services, and talk about the fact that we sometimes, as much as we appreciate and understand that health should be taken care of by ministers and ministries of health, but in the absence of those, we always tend to create parallel systems, none of which can be sustained beyond the funds that we are receiving during a response to a crisis. And I'll give an example. When we were responding to the situation in Zatari camp, we created a whole parallel system to the Jordanian system. The Jordanian government kept insisting that we need to invest in their health facilities so that those can provide access and provide services to the Syrian refugees and can be sustained beyond the crisis to respond to the needs of the most vulnerable Jordanians in host communities. We couldn't do it because we are designed in a way where our funds have to be divided between humanitarianism and development. We don't know how to plan holistically, and that's why our investments in most cases are unfortunately wasted and not sustained. So thinking collaboratively in a meaningful way is going to be critical, and that's the only way to make a difference if we are serious about making a difference. Innovation. We've been talking about innovation for quite a long time, and it is so unfortunate that where I sit in London, in most of those summits and events that you go to, you start talking about innovation in the most spiritual way, and then you end up talking about innovation as an app on your smartphone. So we really need to be just clear and remind ourselves that innovation is not only technology. In fact, most of the innovative solutions to the micro problems happens and gets developed and gets implemented at the very local level. I've seen in Zatari camp, I've seen in Burj al-Barajna, I've seen in Gaza and the refugee camps there, people finding solutions by utilizing very limited resources, and that innovations in those contexts are driven by the necessity to survive, but not by the luxury of coming up with something fancy and new to take to scale. Let's remember that not all innovations need to be taken to scale. Some innovations are local, and they need to remain at the local level. And what we can do really well is make sure that we facilitate the exchange and the transition of those innovations from a South to a South-based organization. So let's think bigger than just technology. Dr. Shadi talked about a very critical point, which is contextualization. And this is something that we take very seriously. In fact, in the Humanitarian Leadership Academy where I work, and with the support of the likes of the UK government and Al Walid Philanthropies, we are just about to launch a very critical partnership that we feel very proud of with GHI. And the whole idea of this partnership was a result of a very interesting discussion with Dr. Shadi about what it means to contextualize learning and contextualize innovation. And I'm hoping that while I'm here in Beirut, we will be launching the Middle East Center for Humanitarian Advancement together. And as a result of this partnership, we'll be able to develop a humanitarian management diploma that is designed for aid workers in this region, in the Middle East and North Africa, and can provide them access to top-notch quality learning opportunities, but in Arabic, because we do genuinely believe that local problems need local actors to solve it and to take things to their hands. I can talk endlessly, but maybe I will close by a story that's very dear to my heart. I was responding in Zatari camp with a couple of colleagues who are in this room, actually. And it was end of December. It was quite cold. And there was a 21-year-old pregnant woman with twins who had to give birth to those twins in a tent where the temperature was, I think, -4. And we had to come together around her, cover those little premature newborns with our jackets and coats, and rush them to nearby facilities or health services, just to find that those health services are not prepared to deal with such situations. One of them, unfortunately, did not make it, and the second did. And for that to happen, the mother had to be evacuated from the camp with the child and separated from the husband and the rest of the family. This is what health service is all about. It is not about fancy hospitals. It is not about papers. It is about relevance. It is about not only saving life, but promising people a life with quality. So when you write your researches, when you think of your papers, when you attend conferences, and when you fly the world to meet with like-minded people, just bear in mind that in the heart of all of this is an underrepresented individual who's extremely vulnerable and is dependent on you to make their lives better. So please do take a moment to remember why you're here and work to ensure that the lives of young people, vulnerable people, is better than the lives of those who we lost, unfortunately, because of our inability to respond to their needs. I thank AUB again. I thank Shadi, a personal and very dear colleague that I respect, and I'm so proud of this partnership that we are just about to start. Thank you all, and best of luck for the coming 2 days.